People will call me a lot of times and say, well, my sister had a BBL and how long does it last? Because hers deflated after a certain amount of time. It looked really good in the beginning, but it doesn't look so good anymore.
People come for a Brazilian butt lift or buttocks fat transfer, and they think that they're taking, and they're correct, taking fat from one area and putting it into another area. And I always have to start them from the basic. What is the basic? Well, you're not taking fat. What is fat? Okay? Fat is a tissue made out of fat cells known as adipocytes. Essentially, the majority of that area has billions and billions of fat cells. Okay? Fat cells or any cell within your body requires the same nutrition and oxygen that your body needs. Essentially, that's why we eat. We don't eat for us. We eat for our trillions of cells that reside in our body. Cells require nutrition. They require energy, right? And that's what happens. Your gut breaks down the food into energy and it supplies it to the cells. They also require oxygen to break down that energy and to make ATPs, which are molecules for energy. And for that purpose, they require oxygen. If you take fat cells out of a human being, and people used to do this, by the way, especially in Dubai, there was a lot of practice of taking fat cells or fat, freezing them and injecting them in the future. A concept that never ever makes sense to a doctor or a scientist. Well, if you take the fat cells, you put them in the freezer, you destroy the cells. We already know cool sculpting works on that premise of destroying the fat cells by freezing them. So how can you take the fat cells, freeze them for 6 months, and then inject them back to the patient? Well, you're injecting dead cells back, and that's unethical in a sense. But hopefully nobody does that anymore. So you have to think of it as cells. I'm retrieving billions and billions and billions of fat cells, and then I'm transferring them into another area. Well, if you transfer into an area that has no oxygenation, no blood to bring nutrition, the fat cells will die. Okay? There's a lot that goes into fat transfer, whether it's for your face, whether it's for your breasts, whether it's for your thighs, where we see a lot of patients have been over liposuction and we have to put the fat back, or your buttocks. They all produce different results, but if you understand the principle, you understand why. For example, recently we had a patient who didn't have a lot of, really had no buttocks. Essentially, I was injecting fat underneath the skin. Well, that skin it has a good blood supply, but when you put fat within fat, i.e. fat into your buttocks, it survives so much better than putting fat into your breast glands. Okay, different tissues, right? So ultimately, it comes back to transferring living fat cells into an area that has a rich supply, or at least adequate supply of oxygenation and blood supply for the fat cells to survive. So that's what I was researching on for many years, and still an ongoing research. So it's important how you retrieve the fat. It's important how you harvest the fat. It's been shown that if you take the fat cells with a high pressure liposuction machine, you will break the fat cells, because the trauma that you create at the time of liposuction is super important. The size of the cannula is super important. If you use tiny cannulas, you're breaking fat. If you're using big cannulas, you get a lot of fibrous tissue coming in. So you have to use like a 4 or a 5 millimeter cannula. Anywhere from 3 to 5 will work, so that you don't create a lot of trauma. If you use a liposuction machine that has an on and off button and sucks the fat with a high negative pressure, it's been shown that the fat cells burst as they are being liposuctioned. If you look at fat cells under a microscope, essentially they have a membrane and it's full of fat and lipids. So they are super sensitive to liposuction, and they typically can break at the time of liposuction. If your membrane breaks, your fat cell dies, essentially. So you want to remove the fat cells with as least trauma as possible. And that's why we use a liposuction machine that you can turn it down and liposuction the fat cells gently. Because if you don't hurt them, they have a higher chance of survival. And we've done the studies, and we know what pressure is best to liposuction the fat at. So now that you've removed the fat, then you have to inject it correctly into areas that have a rich blood supply. And in my experience, when you put fat back into fat, like your buttocks has a lot of fat, it survives much better, and we get about 80% take. What does take mean? Take means the survival, the ultimate permanent survival of your fat cells. So if your 80% of your fat cells survive, that's a really, really high rate. In breasts, it's like 50% because you're putting fat into breast tissue and into the fat tissue surrounding your breast. And again, I believe that if you put the fat within fat, it survives much better than putting fat into breast glands or fat into muscles. So that's why it's so important to understand what your plastic surgeon or your surgeon is doing at the time of liposuction and then fat transfer. Also, it's been shown that we talked about harvesting fat, but some people take that fat that comes with fluid and blood and mix it up and then inject 800, 900, 2,000. They just go overboard. They think the more you inject, the better it is. Well, it doesn't work like that, people. The fat, it's fat cells. It's been shown that if you mix up the fat with blood, actually the fat cells die. Also, when we liposuction you, we're going to inject 4 or 5 liters of tumescent fluid. That fluid is a numbing fluid that has lidocaine and epinephrine in it. And those 2 medications also harm your fat cells. So for these people that retrieve the fat cells with tumescent fluid, with blood, shake it up and inject it, you're actually damaging the fat cells that you're introducing back to the patient. And you're reducing the capability of the fat cells to survive. So we never do that.
So it's essentially quality over quantity in this case.
Absolutely. Great. Yeah, it's quality over quantity, because that quantity means nothing. Once the blood is absorbed, once the fluid is absorbed, once half of your fat cells die, then your results will ultimately dissipate after 6 weeks or so, once the inflammation is gone. So it's super important to take viable fat cells and put them around viable fat cells. And when you do that, you increase the chance of that introduced viable fat cell to survive by obtaining nutrition and oxygen from the surrounding neighbors. So it becomes like a community. You're introducing a few people into that community, and you rely on the neighbors to essentially feed them and help them to assimilate in that environment. So that's what is important. So we take our fat cells, we clean them, we actually wash them with lactated ringer, which is a fluid very similar to the fluid that you find in your body between your cells. So we get rid of all the blood cells, we get rid of all the medication, and then the consistency of our fat becomes like cottage cheese. And then we take that cottage cheese and then use small cannulas to introduce them and micrograft them. And that's another important thing, because if you introduce a chunk of fat with one injection into one area, it's like introducing 1 million people in middle of Irvine and say, okay, go and survive now. Well, you can't, right? You need to disperse these people in a bigger area so that the neighbors can help them to survive. It's the same thing here. If you introduce a chunk of fat in one area, the center of that fat is going to die because the center is not, or the fat cells residing in the center are not going to get enough nutrition and blood and oxygenation, and only the fat cells at the surrounding will survive and the center dies. And that's when people come and say, hey, I have lumping, I have calcification, I have pain. Dr. So-and-so did my plastic surgery and it looks uneven and it's hard. That's why, because you have a whole chunk of fat that was injected into one area. So you have to inject the fat as tiny droplets throughout the butt. When you do that, the tiny droplets are being placed within other fat cells, so they are not going to migrate. If a portion of those tiny droplets that are not still billions of cells die, it's not going to affect it because they're droplets, they're tiny droplets. And then you don't get lumping, you don't get calcification, you don't get microcysts, and it looks very natural.